Kriston Reisnour. She's a hygienist and an accredited hygienist of our academy, and she has 6 other degrees. She's an accomplished, sought-after speaker, author, and an integrated healthcare implementation specialist. She fully believes in the power of building a relationship to motivate and inspire individuals. Her experience as the dental program director for the Bale-Dunning method and work with many directors at the Seattle Study Club solidified her passion for coaching and educating healthcare providers on their role in today's integrated healthcare system. By combining her own personal first-hand experience with her expertise, she delivers compelling and relatable presentations for conferences, online events, interviews, panels, meetings, retreats, workshops, and seminars that have been met with rave reviews and can be adapted to suit your venue and audience. So please give a warm Academy welcome to Kriston Reisnour.
Hello, thank you. It's an honor to be here with you today. First, I guess, we hear all that you do, but I want you to know my why. I want you to understand me a little bit more, why it's so important to me to give you information about this inflammatory process and how you can help your patients. My mom died at 58 and my dad at 60 from end-stage diseases. They didn't get to enjoy us in our adulthood or their grandchildren or even meet their great-grandchildren. Lives taken too soon from chronic disease. So I did all I could educating myself so that I could gain knowledge so I could give it to my patients or other people that I knew, because I truly believe that education that is gained but not shared is wasted. How many of you here have had a loved one or acquaintance or that die from end-stage diseases? Right? It's all around us. It's the medical system. We're treating disease versus prevention. So today we're going to be talking about where there's smoke, there's fire, and help you kind of look at your patients, find inflammatory markers on their medical history, find out how to treat them, and then work collaboratively to work with other healthcare providers to give them the best optimal care. So I guess I am supposed to read this disclaimer here. I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program. But I do have to say that I am a trainer, dental education trainer for OralView. They're in booth 35. If you like the presentation, please let them know, stop by. That would be greatly appreciated. And definitely stop at all the vendors and that. It's so important what they're doing and being here for us and supporting us. The objectives is to help you understand why that fire, inflammation gets out of control. It's going to be very simplistic versus the wonderful presentation you heard earlier. Identify the smoke signals on those medical histories, and then kind of recognize that there's 3 igniters that you as dental professionals can work at in your dental practice that can stop what we call a 5-alarm fire. Chronic inflammation, we know that it's been studied back in ancient times, Egypt and in Greece, and many diseases have been caused by this chronic inflammation. And many scientists now look at it and saying chronic inflammation is the root of all disease. As you see, I have that beautiful tree there because it just symbolizes the root system. You got this beautiful leaves, beautiful trunk, and look at that root system spread out. What happens is that if that tree becomes sick, and what I mean by that is the leaves start to shrivel. They start to get black. The trunk becomes a little bit warped. It starts to peel. Are you going to treat the leaves? Are you going to treat the trunk? Or are you going to go to the root system, the lifeline of that tree? That's what we should be doing, looking for the root causes of disease, treating the inflammation, that cause, so you can reduce that inflammation, stop the disease process, and then therefore progressing into longevity for that individual. Just going through briefly, again, this is real simplistic, inflammation, just touching on it. Inflammation, it's your immune system's response to invaders, all right? It's a biological response. And these invaders can be infectious, such as pathogens, bacteria, viruses, and other microorganisms, or it can be non-infectious, physical, chemical, burns, toxins from your environment. We talk about a lot of mercury, different toxins that you're exposed to, or even damaged cells within your own body. Your body wants to identify those invaders and eliminate it before it can do destruction. The body is miraculous. It has many barriers in place. The first barriers are going to be as far as your skin, your mucous membranes, which have enzymes in there that can kill virus and bacteria. Then you have stomach acids that kill it before it gets into your system. And even your tears can help fight and be a barrier. What's going to happen? You might have a cough, a sneeze. Unfortunately, you might have vomiting or diarrhea. But if it gets past the next barrier is where your innate immune system takes place, specialized cells. Right? These cells are going to inflammatories. It's all going to work together to try to contain that invader so it doesn't do destruction. And it gets past the next barrier, it goes to your adaptive. I look at it as, we talk about the 5-alarm fire. What's going to happen if, by chance, Barb, say your house is on fire, what are you going to do? You're going to call 911? Call your area local fire department and come over there with their specialized trucks with all their equipment and their specialized training to put that fire out. Right? And typically they can get there before there's a lot of destruction to your house. They put it out, and then what happens? Eventually you rebuild, right? Get it back. That's how the body responds in acute inflammation. But let's say that for some reason your house is on fire and those sparks reach your neighbors. You know, then your house becomes on fire and your house becomes on fire. Then what happens? Your body, it's just like your body. Inflammation goes out into the whole system. What happens in a 5-alarm fire is if they can't contain that fire and put it out so it doesn't do destruction, it starts to spread, they're going to call area fire departments. And they're going to come with their specialized engines and all the information, all that tools that they have to put that inflammation or that fire out. And that's just basically how the body responds. A simple way to look at it. But inflammation is necessary. It's necessary to heal. We need that healing process, and without it, we wouldn't. We have acute and chronic. Again, acute is the short phase. Typically, everything is, they get that trigger under control. They stop it from getting into the rest of the body. There's a little bit of cell damage, tissue damage, and then the body gets back to homeostasis. But the problem is that whole process doesn't stop. You've got a ton of pro-inflammatory markers going out, inflammation, specialized cells in your system, and then it starts to attack different cells and organs. And that's chronic inflammation. And when that gets out of control, it leads to, unfortunately, chronic disease, poor quality of life, and premature death. I wanted to talk just briefly on this and just simplify it down a little bit. With gram-negative bacteria, they have lipopolysaccharides within their cell membrane. And one of our surface pattern recognizers will actually, with toll-like receptor 4 and 2, will recognize patterns on those gram-negative bacteria. So think about like little projections on the cell wall. Just easy to do it that way. They're toll-like receptors, and they're stimulated by that pattern. So when that toll-like receptors get stimulated, it acts like a bridge into the cell, into the cytoplasm, the middle of that cell. And a whole host of biochemical reactions occur. Those biochemical reactions translocates nuclear factor kappa beta into the nucleus of the cell and changes the genetics. So a host of biochemical reactions, cytokines, interleukin-1 beta, tumor necrosis factor alpha. Those are just a few that are released, that whole cytokine response. So keep that in mind that when we talk about gum disease, bleeding, healthy tissue doesn't bleed. Where in the body can you bleed? Like some of you, how many of you had prophies that were just bleeding like crazy, where your gloves were just full of blood, right? Healthy tissue doesn't bleed. There's something going on. There's an imbalance there that's causing disruption, dysbiosis in that oral microbiome. So keep that in mind. We know that when we do have inflammation, what happens? You're going to get blood flow, so you're going to get dilation of the vascular dilation. You're going to have permeability of the capillaries so that you get more fluid in there, and then complement proteins are going to get into that area. You get the influx of the white blood cells, neutrophils being the primary ones that get in there, they're main attackers. And then you have the other, as far as monocytes and macrophages, and monocytes differentiate and macrophages, the system all contains itself. Well, here's the thing, you're going to have breakdown of tissue in that process. And how much damage of the tissue depends on the trigger itself. Is it localized, or is it systemic, or is it persistent? And then can the body actually maintain it and take care of it? There are many acute inflammatory processes. When you look through these, you'll see that those are just acute. Maybe it's allergic reaction. Maybe it's a chemical burn. Maybe it's trauma. All of these starts that initial process. Even if you get a sliver, same thing, bacteria goes in there, it's not supposed to be there, and your body's going to try to get rid of that. When you get that sliver in your finger, you know how it kind of, you feel it's in there, then all of a sudden you get the swelling, and then it hurts. That's the same process when your capillaries are widening, you get more inflammation, you get more fluid in the area, so you get that heat. Then you get the redness as it continues. You see the redness in this area here. And then you get more activations of the leukocytes, those white blood cells. And if by chance it goes more systemic, that's when you get the fever. This is simply put type thing. The chronic inflammation, though, that's a slower onset, right? Prolonged acute phase. And it recruits more of those white blood cells, macrophages, and lymphocytes. It causes more damage to the actual tissue and the cells, and then the damage to the cells damage the organs, causing that chronic disease. And here are a host of conditions, comorbidities, that you should be able to see on your medical history and realize there's some kind of underlying inflammatory process going on, that immune system's responding. And depending on what's happening with that individual, you know, it could be devastating. But you see Alzheimer's, we'll be talking about that. Cardiovascular disease are kind of the ones that we're going to hit on today. So what I want to get out of this initial quick spot here is, remember, from a tiny spark burst a mighty flame. So when you have that slight inflammation, ask yourself why. Be curious, dig deeper. How many of you have done periodontal therapy on a person? They come back and they're still the same. Bleeding tissue, they've not resolved. And then I've heard of studies where people have done therapy over therapy over therapy before they do blood workup. They might find the person has diabetes. There's a condition happening. There's a root cause. And that's making them balanced so your body's responding the way it does. So potential, how do you recognize? We're going to go through some of these. And then again on Barb's course, she's going to hit on some of the adjunctive testing. But it begins with your medical history. Look for comorbidities. If you see comorbidities, understand that there's an inflammatory process that caused it. Then ask yourself, can that person afford to have any disease going on in their mouth? What all do you have to do to actually heal that individual? Observe that patient. Look at that patient when they come in or when you're sitting in the waiting room. Do they look tired? Is their jaw protruded forward? Do they slump forward? Do they carry their weight in the midsection? Metabolic syndrome. Do they carry their weight in the throat? That could be airway issue. And when they walk, do they walk like they're in pain, or do they have a certain gait? Look at all those before you sit them in the chair. Then you're going to do some life-saving screenings. We'll talk more about that. And then what do you see clinically? What's the big picture? Whether you're doing the CBCT, looking for cavitations, asymptomatic, endodontic lesions, get all that information to put the pieces together. And then some offices will go further and do the adjunctive testing. Fire panel, those medical blood and urine tests. You might do a CBCT, complete blood workup panel. Oral glucose tolerance test. 70% of the individuals who have atherosclerosis have oral glucose tolerance, insulin resistance. A test that's positive for insulin resistance is the oral glucose tolerance test. Vitamin deficiency, D, is rampant. So look for all of these. I'm going to show you a video of a carotid intermediate thickness. We can actually have that tested. A1C, your pH testing. Maybe you're doing carie swabs. We'll touch on those, but Barb's going to go into those in more detail for you. When it looks at the medical history, all right, any vascular issue that's going on in that patient, start to think inflammation. Erectile dysfunction, that's an atherogenic inflammatory process, micro-inflammatory process in and of itself. So look for these things. Here's just to give you a statistic. If you see a person has a heart attack or a stroke, 23% of strokes are recidivistic. That means they've happened before, and that person can have another one. If it happens to be a Caucasian woman or African American woman, they're more apt to have a second event. And unfortunately, an African American person is apt to die of that event. When it comes to heart attacks, 50% of heart attacks are recidivistic. When they have that second heart attack, half of those will die from it. So when you see those on your medical history, do you have to act? You have to really look at how you're going to best treat that person. High blood pressure, look for that. Take the blood pressure, see where they are. Drug-resistant hypertension, sleep-related. But these are all inflammatory processes. And then we know that depression, PTSD, related to cardiovascular disease, and also airway. So again, see how everything's kind of molding together? Don't forget your insulin-resistant diabetes, and then your breathing. They have asthma, issues like that. They might have airway issues, breathing issues when they're sleeping. Acid reflux, they show that. That's when a lot of times that's due to having an airway issue. All right, and then when you get to headaches, morning headaches, oxygen deprived, a sleep issue. Migraines, look vascular-wise. Medications, always look at their medications and find out why they're taking it, because it can tell you if that person might be have metabolic syndrome. Say that person carries their weight in the midsection, right? And they come in and they're saying that they're taking blood pressure medicine, they're taking cholesterol medicine. 3 strikes. It's either the weight carried in the midsection, you got cholesterol medicine, you're taking high blood pressure, you have high blood pressure, 130/85. I think it's 110 or greater for if you have glucose issues. You take all of this information, and that's going to tell you more about that patient and the inflammation in their body. Don't forget to ask about family history. Heart attack, strokes, diabetes, dementia. Do they have any sleep-related issues in their family? Wearing a CPAP. Ask these questions, find out as much as you can, because you have everything right there in the palm of your hands. Then some offices are doing sleep forms or different type of forms. Epworth Sleepiness Scale is well known. Stop bang. Lambert's questionnaire. Dr. Lambert sent this question, his most recent questionnaire to us, and we can have Kim definitely print it off if you need it. He also has the pediatric one. It goes through different systems, which that's what I like, and the patient goes ahead and fills it out. So whether it's cardiovascular, whether it's pulmonary, and then the fatigue scale. When it comes to your life-saving screenings, take your blood pressures, check 130/80. Keep this in mind, most of the physicians want to see it lower, 120/80. Pulse less than 75. If the pulse is greater than 75, especially for women, you're looking at a metabolic issue like insulin resistance. Don't forget to do your, I do the pulse ox. I did this way before COVID because I wanted to know if that patient in my chair has a low pulse ox just sitting there, when they go to sleep, I know that oxygen's going to desat. And we don't want it to go way below 90. But if they're like at 90, 92 when they're sitting in your chair when they're awake, what's it looking like? So then you can refer that patient out to get a test done. Nitric oxide testing, phase contrast microscope, those are all different things that Barb's going to cover. pH strips. You can do your airway assessment when you do your oral cancer exam. Every hour, every day, somebody dies of oral cancer. So if you can do these exams, that's another thing you can do for your individual patients. And then some different types of as far as blood workup, A1C chair side. Saliva testing, there's different companies that do it. Oral DNA, Oral Vital, Haynes Diagnostics. You got Direct Diagnostics that look for the 5 high-risk bacteria. New, we have Silha. They're actually one of our, we saw them out in our booth, or one of our vendors stopped by there. And there's also Bristol Health, which looks at the complete oral biome. So there's many companies that are doing that. Get a complete picture. But remember, when you get these saliva tests, make sure you're looking bacterial, viral, fungal. Look for these things. Even if they have dentures, go ahead and be tested. What's interesting is, then we learned today, MMP8. Find a company that's going to do that for you, because it is so vital, again, to get the whole picture. Learn what's going on with their microbiome. What's it saying about their health? You have good and bad bacteria living together, kind of like playing nice in the sandbox, right? In your body. Something's got to trigger them so that balance change. So those bad bacteria take over. Those bad bacteria can even recruit some of the good bacteria into being bad. So there's triggers that our body is facing every day that can make that happen. All right, let's see if this is going to work for us. Let's see. It doesn't want to do it. Hold on. This is a great video, so I want to show it to you because this is a chairside test screening that you can do. And basically what it does is you can actually look at the carotid intermediate thickness, and you're looking at the bifurcation, and you are looking for types of plaque. If you see disease in that arterial wall, then what happens is you can go ahead, I think Cure Coach is the one that does this with Butterfly, send it off to the medical doctors. They're going to give you a diagnosis of what's going on in there and give you some things that you can do for that individual patient. So what you're looking here is you're actually seeing, when you look at, let's see if this will show you here, there's the main bulb there, and you're looking to see that whiteness, plaque in that arterial wall. So this is a diseased arterial wall. So now you can do better for that patient. We're going to talk about periodontal pathogens, how they contribute to the atherosclerotic process too. So I'm going to go on, and I might do a little overlap, but inflammation starts the process. What causes an event, vascular event, whether it's stroke or a heart attack? It's the inflammation. From whatever's triggering it, that inflammation breaks down the endothelial lining. Right? Makes it weaker, makes it more permeable so more material can get in, more cholesterol, bacteria, all these things can get into that lining, and that fatty streak starts to grow. And when that fatty streak's growing, what happens? What happens? It continues to grow as inflammation continues because we didn't address the inflammation. So finally that poor endothelial lining cannot hold back the plaque, and it pops out. And where it pops out, what happens? Your body wants to heal itself. And where that clot forms a clot. Where that clot lands is what gets its name. If it lands in the brain, we call it a stroke. If it lands in the heart, we call it a heart attack. So think about this. High-risk periodontal pathogens contribute to the atherosclerotic process. Are we ready? Let's see here. Okay. So this is the Fire Pan of the Wellness Dentistry. You can order these up, and for $130-some, what a great amount of blood and urine tests that you can do for your patient. You can add like TMAO, trimethylamino N-oxide, that's for the gut. Seeing how you're doing with that as far as how you're breaking down your Western diet with meats. And then now we're going to jump. Any more questions about that? We can answer more questions at the end if you want, because we'll have time. All right, so I'm going to go a little fast. So you let me know, because we have to hit on all of these issues, and I apologize for the technical delay, okay? Igniters that you can actually work for in your practice: oral health, gut health, and sleep health. And although those conditions can cause many comorbidities, we're going to talk about cardiovascular disease and Alzheimer's. So let's look at oral health. What's your percentage of periodontal patients in your office? Anybody know? Anybody willing to throw anything out there? Yes. 40%, okay. Anybody else? Or sometimes you just don't know. Well, I want to ask you to think of this differently, right? If the CDC says that periodontal disease is one of the most prevalent diseases, kind of similar to cardiovascular disease and diabetes, and if periodontal disease at the age of 30 or greater affects 50% of the patient, and when you reach 65, 70%, shouldn't those percentages be at the bare minimum 50? Bare minimum. That's doing the minimum. We know that almost 94% of the U.S., people in the U.S. have some form of dental disease. We know that those bacteria can get into the blood, cause bacteremia, and it can hit every single system within 1 minute. And as I said earlier, that when that happens, you can have a vascular event, acute or chronic, up to 30 days after. We're going to talk about these high-risk periodontal pathogens: Agrobacter, Actinomycetum committens, Porphyromonas gingivalis, PG, Tannerella forsythia, TF, Treponema denticola, and I add Fusobacterium nucleum. Now, these are high-risk cardiovascular. Some people will say that FM belongs in the moderate risk, but all of those have been known to cause cardiovascular issues. So wouldn't it be nice to know, just as you're doing the whole composite, to figure out how to treat that patient if you know what the microbiome is? We know that when you treat periodontal disease, it decreases your cardiovascular risk. It also decreases the carotid intermediate thickness. And your plaque, LP plaque 2, that's another test that I can get a chance to tell you. That's going to test, it's going to tell you how inflamed that arterial wall is. And then your A1C, it will decrease that too. I took all those 5 high-risk bacteria and I put them next to some comorbidities. And if you can see here, we have cardiovascular disease, Alzheimer's, we have diabetes and cancer that have all 5 of the high-risk bacteria. Of course, there's other things that's collected into those, but I'm just looking at these bacteria. Then we look at women's health and pregnancy, then respiratory tract infections, right? Those have at least 4. And then you go down further and you got autoimmune disease and also bone and joint. This is a slide, let's see if it's gonna let me do it, a phase microscope. And you see that it will show you many things. See those little spirochetes? Those lovely little snake little creatures there. Can you imagine those getting to your brain, kind of swimming around? It gives you a visual. And then if you look for trichomonas, little mice is what we call them. Barb has a video of that. And then amoebas, those nasty amoebas. What do they like to eat? White blood cells. And when they attack those white blood cells, they put out a bunch of enzymes, right? To recruit more white blood cells to help them. It's a smorgasbord for those amoebas. They're nasty, nasty, nasty. But wouldn't you want to know, I like to combine things. Use the phase microscope to show people because it's such a great motivational tool and can move them into doing treatment. And then you can show them how well they've done. But I want to know the quantity and the quality of the microbiome, the whole picture. So use them together. Here's a picture of one of the oral views. You know, you hear, well, you don't have to take the calculus off. You just have to remove the biofilm. I'm going to submit every time I use an endoscope and I go below the gums and I pull that tissue away from the calculus, there's inflammation there. And why? I look at it as, calculus isn't causing the disease, but think about the bacteria that live within it and the biofilm and the toxins that are right up against that tissue. So with this endoscope, you can see down below, and it's also used diagnostically. You look at, is there a fracture that's causing an issue with that tooth? Is there perforation? Is there faulty restorations? You can look at all these. The patients get to see them. You can actually send a video and pictures into the patient themselves, to their medical doctors, and also into their files. Periodontal disease. Again, I'm going to cut some of this, so please let me know if I'm talking too fast. Okay, I grew up with 5 sisters, so I can learn how to talk to get a word in edgewise, right? So please let me know. When we look at periodontal disease, we know that as far as cardiovascular disease, you're almost 4 times more likely to have a heart attack with severe periodontal disease or 2 times more likely to have a stroke. We've already talked about the carotid intermediate. We'll go through that a little bit more. And then also there's level A evidence, hardest evidence that you can have that periodontal disease is associated with arterial health. How does that happen? Those toll-like receptors we talked about earlier in the conversation, they actually will increase the permeability of the endothelium. Toxic effect, toxic damage, direct damage to that endothelium. The substances like leukotoxins actually can stop the cells from proliferating. It can cause apoptosis. When you say that fast, it's hard to say. Apoptosis, that's actually the cell killing of the cell, programmed cell death, basically. And it increases cell adhesion molecules. Those cell adhesion molecules, VCAM and ICAMs, and also for the macrophages to release matrix metalloproteinase, right? And then also there's direct invasion as that pulls apart the endothelium through cadherins, fadherins, this process. Pulls it apart and leaves holes in the endothelium so those bacteria, fusobacteria, can dive directly right into it. They do affect all of the steps in an atherogenic process, okay? Here's what a beautiful, healthy artery looks like, the lumen. 99% of the plaque grows away from the lumen. The lumen is the hole. 1% grows within it. Healthy artery there, the disease, again, we talked about it. Inflammation starts the process, plaque, cholesterol, materials get in there, atheroma is formed. It's inflammation that continues that causes that plaque to come out and causes an event. Here you have another example. You have the lumen. You don't see any plaque or any stenosis within that lumen, and then you have basically plaque underneath the lining. The endothelia itself breaks down, plaque comes out and causes a clot, and this person did not survive this event. We know that there have been studies that have shown that carotid endarterectomies, taking the plaque out of the neck, that they've had, this shows you that at least one or many multiple bacteria in the oral cavity have been found in these atheromas. Dr. Najjar showed his patient. This is a 72-year-old man. He had left carotid stenosis. Stenosis is the blocking of the lumen. Remember, 1% grows within that lumen. The other 99% grows outside of it. They took that plaque and they analyzed it and analyzed the bacteria from his gum disease, his severe gum disease, and it was the same bacteria. So what I want you to do is look at your patients, be curious. Why are they in the state that they're at? Look at that individual, look at the x-rays, look for things. We also know as far as in your heart area, they did 44 coronary endarterectomies, and what they found, getting down to just the results here, 64 of those plaques had 2 or more of these bacteria and the gum disease bacteria. So it's not coincidentally they come out with the atheroma. They're part of it. They're causing it. Dr. Pesce, he did a study. Now, this I think is great. There was 101 patients. They were in the midst of having a heart attack, acute heart attack. He went in there and he aspirated the thrombus, and then he also aspirated arterial blood. What he found, the bacterial load in the thrombus was 16 times higher than the arterial load. He found that oral strep variants, 78% of the time were found. And then, of course, periodontal pathogens were found 35%. Do your CBT 3D imaging. Find out there's asymptomatic endodontic lesions. Look for these things on your patients. All right, now we're going to go Alzheimer's. Alzheimer's, again, you can see that there are many bacteria that contribute to it. What we're going to look at, we talked about the spirochetes just briefly, P. gingivalis. That's a nasty bug. It invades and inflames the brain. It triggers a release of amyloid, which actually can cause the neurons to die, right? And then it actually can penetrate and invade white blood cells and your T cells, and the lining of your vessels can get in there. Then it goes even into the cranial nerve, and it passes from cell to cell over time until it gets to the brain. It's a nasty little bugger, right? And almost 90%, 94% of the patients have dental spirochetes, and we talked about that. They looked at it and said bacteria in the brain are not a result of Alzheimer's, but could be the cause. Well, now a paper just recently came out that shows that it is the cause. It is not atherosclerosis and Alzheimer's. That's not an inevitable part of aging. That means it doesn't have to happen. It's all caused by inflammation. One study, this was Professor Holmes, which he said was so scary. The reason it was scary is he looked at 75 individuals with periodontal disease, and they were 75 years old, I should say, with periodontal disease, and 79 years old without periodontal disease. And with this 6 months, there was a severe decline in the individuals who had periodontal disease, up to 6 times increase in cognitive decline. So again, know what you're dealing with, whether spirochetes, gum disease, bacteria, viruses, pneumonia, H. pylori, fungus. All of these have been found in the brains and autopsies of individuals. And when we talk of H. pylori, we're going to talk about the gut. Okay? How are we doing time-wise? 5 minutes? Oh boy. Put on your seat, people. 10 minutes? Okay. All righty. Just know that with the gut, 70, some camps are saying 80% of your immune system resides in the gut. It's your second brain. It actually is the same fetal tissue as your brain. It's considered your second brain, or your forgotten organ. It's an enteric nervous system. There's a direct link between the microbiome and other pathologies. And when you see someone who has chronic disease, basically, you look at the gut microbiome, and it's less diverse. It doesn't have a lot of the good bacteria. It's a change, especially when they're diseased. How that happens is you have the single cells. The single cells will allow, when it gets inflamed, those enterocytes that are connected by connective tissue actually open up wider than they should. Instead of letting nutrients in, they're letting food deposits, bacteria, and they get into your bloodstream and they cause a host of inflammatory conditions which can lead to comorbidities, basically. And you can see here all the comorbidities that the gut microbiome can attest to. When it comes to cardiovascular disease, what you eat, the Western diet, if you're eating too much red meat, your TMO will actually go to liver and it changes to trimethylamine and oxide, and that can cause vascular issues. You get short-chain fatty acids that are decreased, and that causes the endothelial, those cells to break up. So a host of different things you get in. Basically, the intestine starts to leak. Then we have the brain-blood barriers that are leaking. So the microbiome, if they're not in a nice balance, they're overgrown, they're going to cause leakage. They produce their own toxins. Then the gut starts to leak, and material gets into your bloodstream, and then it crosses the blood-brain barrier, and that causes the brain to have issues, neural inflammation, neurodegenerative, and also, that's where Alzheimer's comes in too. Okay, now we're going through obstructive sleep apnea. It's an inflammatory process too. The apnea hypopnea, not breathing, is going to cause you to have your central nervous system. You're going to have issues there. You're going to have a fight or flight response. You're going to have basically all these host of chemical reactions are happening because your body wants to survive. It wants to take the next breath, and if it's not getting enough oxygen, it's going to have issues. It causes inflammation, oxidative stress, endothelial is going to have dysfunction, and that leads to a host of vascular issues, diabetes, Alzheimer's, and that. And we do know that anybody who has sleep apnea increases their risk of having Alzheimer's disease, and if you treat it, it decreases it. Okay? All of these conditions on your medical history, whether it's 30 to 80% of these conditions, are caused by sleep-related issue. Look for, as far as acid reflux, headaches, all of these things can cause issues. So you need to look at these younger kids, because take a look at that baby. She doesn't have lip competence. Her lip is open. And if by chance that baby isn't taken care of, she's going to have chronic inflammation throughout her life, and then she becomes an adult. And then the adult will have issues with chronic disease, cardiovascular disease, and then cognitive decline, Alzheimer's. Women who are pregnant start to look at the bacterial load there. Stacy Chu, she was 39 weeks and 5 days pregnant. She lost her little baby girl. She lost it to FM, Fusobacterium nucleatum, crossed the placental wall, attacked that baby, which had no defenses, and it killed her. She had an autopsy done, and that's how she found that out. She went to her dentist. They said, oh, you're just bleeding. You have pregnancy gingivitis. Find out what's going on. Set them up for success. Look to see if they have any oxygen issues, because an oxygen-deprived mother is an oxygen-deprived fetus. And it's going to shape that baby through epigenetics throughout the whole entire life. All right, we're almost there. All right, for those dentists, don't look at that temp bridge. He came to the office that way. But what I want you to do is take off your dental hat and put on your medical hat. Family history of cardiovascular disease, high blood pressure, cholesterol, abfractions, and recession, not to mention the inflammation. All right, so that should tell you something right there. Start thinking about that. What about when you look at the plane? Narrow arches, incisal wear, abfractions again, faulty restoration, it's got those amalgams in there, right? Inflammation. Now we look at the upper arch, high vaulted palate. His tongue wasn't getting up there when he was younger to actually form that, push the palate wider, form the sinuses the way they should be. We have faulty restorations there too, amalgams, wear on those teeth, pronounced rugae. Here's a new one, Fordyce granules. When we went to school, they said, oh, just make sure you micro down so you don't get a 0 or minus. You just had to put it down there, and it was benign. You have Fordyce granules in your patient's mouth. That's your body's way of trying to get rid of cholesterol. That person should have, and you saw he had high blood pressure, cholesterol issues. That person should have a complete cardiovascular workup, find out where their cholesterol is, have a CIMT if they haven't done that already. This is an airway issue. Root causes airway. So anytime you see these conditions, Mallampati 4, scalloping on the tongue, uvula, high vaulted palates, and almost kissing tonsils, and you see that there's a submucosal tongue tie there, the tongue's raising over the roof of the mouth, parrot look, wear on the teeth, and don't forget to look up the nose, see what you see. There's many things you can find up there, but if you have asymmetry or you see this, think of an airway. It's inflammation, airway. Okay? Now we finally get to the 5 alarm. This is where I need some participation. Okay? I know I went through a lot of this fast, so forgive me. Is this a medically compromised patient? Ready? What do you think? Right? And here's the thing. You get these patients to come in your chair, and I always say medical history, medical history. This person put nothing down on their medical history. Nothing. More people will see their dentist than they see their medical doctor, and there's reasons why they do that. So this person comes in, I see that she's carrying her weight in the midsection. So she has some adipose tissue that's going to be inflammatory. See, she has a thick neck. So metabolic syndrome, all these things are going through my head as I bring her in. But she's holding her head down, she's looking down. Psychological issue, right? The first thing you have to deal with this person, find out psychologically. You have got to get a connection with that patient. So is it diabetic? Could be diabetic, right? Could be insulin resistance. Could be metabolic issues. Could be obesity-related comorbidities. Breathing related, we see that the tongue raises above the occlusal plane. She's got some scalping there. High blood pressure. Wonder how the vasculature is if you see how inflamed that tissue is. Right, I just said that. And then acute autoimmune diseases. What's going on there? Is this an autoimmune issue? And that's why that tissue is looking like that. Apical lesions. Does she have any asymptomatic? We see rampant decay back there. What's going on? Psychological issue. The first thing I had to address with her is her fear, high fear. So if we didn't make her feel comfortable, I always say, never make your patients feel less than. Patients don't care how much you know until you show them how much you care. So that starts that whole relationship process. Make them feel good in that chair. Make them feel heard. All right, and this is what, or depression, anxiety, again, that goes in the psychosocial issue and that. Okay, you ready to see what we did? Come on. There she is. Now, did we not save that patient's life? Right? We did implants, extractions. We took care of that. And Rice Bohr, he does a beautiful job with his photography. He would be so disappointed in me because I didn't polish her porcelain, and I didn't get those little air bubbles. But here's the thing. I wanted to show you what she looked like when she came into the office. We changed her mindset. We changed her life. She's a new person. Now, are there some different things I would do differently? Yes, because, you do the best you can, right, with what you know. Until you know better, then you can do better. So in conclusion, thank you for being patient as I went through this so fast. Review those medical histories, see what they have, look for comorbidities, look for basically the root causes, right? Educate and inspire your patients, make them feel that they're heard and cared about. Do those life-saving screens, do all of those. And remember that you have to individualize your treatment. One plan doesn't fit all. Look at all the pieces of the puzzle, get all that diagnostic blood workup, know what's going on with that individual so you can treat them as the N of one and keep them on a strict schedule. So many times people get periodontal disease, they treat it, and then they don't see the person. Is that fair? No. Keep in contact, work collaboratively, integratively with a healthcare provider at your medical side so together you can help that patient have a long, productive life. You're changing lives because if it's not you, then who? All right? Thank you very much.